Good afternoon, my name is Rebecca Lichtak. I will be making my presentation for my pain management initiative for Villa Health. I'll be looking down at my phone, which I typed out the transcript, which is also in the speaker notes of the PowerPoint presentation attached. I usually have a monitor to show everything, but my monitor does not want to work, but the presentation must go on. This is for class NURS-FPX6016, Quality Improvement of Interprofessional Care. Enjoy. Okay, so this is for slide 2 after the introduction. Data is a crucial healthcare tool that informs healthcare decisions. It provides information that can be used to understand care processes and identify trends that need change or improvement. Villa Health data reveals a gap in pain issues of ineffective and insufficient pain management where some patients did not receive appropriate pain management care. According to Hagarty et al. 2020, pain reduces the quality of life and is common in fear in those contemplating end of life. So addressing this problem can improve not only the quality of life of hospice patients, but can reduce the fear of death as well. Third slide. This presentation will examine the hospice care in Villa Health to identify a gap that needs improvement. It will also propose an appropriate initiative that can address the gap identified while stating the role of collaboration in the initiative process. Villa Health data involves patient survey responses which indicate various quality of care provided to hospice patients and their families. The data also involves an interview of 4 leaders in the healthcare facility of Villa Health who give their opinions on the various aspects of hospice care. While some issues of the need of technology improvement and just the general quality of care have been identified to be an issue by patients, their families, and the people who work there, one of the main issues in all the responses raises some concerns, which is the pain management. In 2020, the hospice patients, only 65% of them received sufficient management for pain, sadness, and constipation and breathing. In 2021, the percentage increased only by 2%, resulting in 68% of the patients feeling like they've had sufficient care or management of these issues or services. The issue of pain management was also raised by the chief nurse officer who considers effectiveness of pain management and symptom management as a red flag at Villa Health. Data of patients receiving pain support over months in 2020 and 2021 indicate that only an average of 6 to 7 patients received the needed support for pain. Other months, as few as only 2 patients received the support, and this is honestly unacceptable. Pain is a diagnosis, a medical diagnosis, just like any other disease or condition, and it needs to be treated as so. The data reveals inability of the hospice care team to provide appropriate pain management services. Pain management is a crucial determinant of care quality and patient safety levels, hence the importance to improve this aspect. The quality of data given can be shown by completeness and reliability. The chief nurse officer indicates that the efficacy of pain management is what should be considered. In addition, the patient report mentions other aspects that can be associated with the lack of pain, including sadness and respiratory issues. It also gives a percentage receiving enough pain management and related problems. Therefore, the information that has been provided is reliable, complete, and relevant. Slide 5. The quality initiative that can improve pain management efficiency is an approach that combines pharmacological and non-pharmacological therapies. AHRQ 2019 report indicates that NSAIDs and Tylenol can be used to manage pain effectively instead of opioids that have a potential for addiction. This is in conjunction with some non-pharmacological therapies as well. Non-pharmacological measures such as physical therapy and mindfulness-based stress reduction can be very useful. Physical therapy has shown to restore normal body function and can correct body malfunctions that cause pain. In cancer patients, this therapy has shown to restore pain management, pain associated impairments such as fatigue, peripheral neuropathy, and lymphedema. In lung cancer patients, mindfulness based stress reduction also addresses psychological problems effectively and promote the ability to cope with pain. Improved psychological health enables individuals to understand and manage thoughts, behaviors, and emotions accompanying pain discomfort, making it better for the individual to cope with the pain. Providers can also educate community members on the importance of referring to patients to hospice care sooner rather than later, so the adherence and the effect of the treatment plan made for them can be more effective. Hospital policies facilitate adherence to professional practice. The hospital can develop communication policies that can reduce understanding and enhance communication and the improved ability of pain management in these patients. And this is being said because the providers can communicate to community members, which is all the healthcare facilities, people who deal with patients, to refer them and to follow up to ensure that they are seeking out the hospice arrangements needed and they're not waiting until it's too late, so their pain can be managed earlier rather than later. Slide 6. The pain assessment of the facility has been described as good by the quality assurance director. However, the chief nursing officer contradicts this and says that the pain assessment is not good and that it's very ineffective and needs management. There is an obvious miscommunication and differing of opinions, which affects how patient care is being held and treated. They should have some kind of standard that determines what is considered ineffective pain or pain management, and they should follow things based on a policy that is created instead of their personal opinions, because if a patient needs to rely on someone's opinion to receive proper pain management, then their pain is not being appropriately controlled. Patient data also indicates that most patients have not received sufficient care for their pain, their constipation, their breathing, even their sadness. The data indicates that most hospice patients are referred to hospice very late, which is a topic we already touched, and this can limit the efforts of the healthcare workers to develop the appropriate strategies that these patients need for pain management during their care. Targeted areas of improvement are medication management to provide appropriate medications with minimal side effects. The psychological state of the patients also should be improved to increase their ability to cope with the pain. Community culture also has to be changed to assist people in addressing the importance of receiving hospice care on time for better pain management. Addressing physical body functions will also be necessary to address impairments such as constipation that can increase pain. Outcome measures to consider after implementing the quality initiative is the level of pain. So having a pain scale with 0 being no pain and 10 being severe pain, the patient should assess their pain, and between the score of 3 and 4, that's when they should be medicated. And the pain should be measured by this pain scale, not too much based on what the patient shows. Because just because a patient doesn't look like they're in pain because of certain cultures that they might not show their emotions, it does not mean that the patient is not in pain. If they say their pain is a 10 and they're smiling, then they should be medicated appropriately. As pain advances, using stronger pain medication may be necessary, including opioids. Proper medication adherence and management can signify and enhance medication efficiency. The level of sadness can also be indicated by, it can also be measured to see if the quality initiative was effective or not, by measuring how the patient feels, their state of happiness or sadness, their perception, and their mental thoughts on life, which can probably be evaluated by a psychologist, and based on their evaluation of the patient, that's how we can measure progress or not. Patient's perception of reduced body impairment such as constipation, improved pain management, that can also be measured to see the effectiveness of this initiative. Slide 7. Utilizing health models to determine the efficacy of quality initiatives is crucial. The model for quality improvement developed by the Institute for Health Care Improvements, IHI, can be used to deliver the initiative. At the heart of the model is the Plan, Do, Study, Act, PDSA cycle. The PDSA cycle prompts data analysis to identify a gap for the improvement and solution to close the gap. These events occur during the planning stage. It also allows for the implementation of the solution identified on small scales during the do stage. The third stage is a study where individuals analyze outcomes to determine if expected outcomes are achieved and identify trends and challenges to determine the worthiness of the initiative. This assists in making adjustments to the interventions to promote a large-scale implementation. The PDSA model can assist in providing medications and therapies and implementing communication policies and communication education to a small number of individuals to determine the effectiveness of the plan before implementing the solutions to all patients. Slide 8. Quality improvement models call for interprofessional collaboration to address patients' needs holistically, from top to bottom, from inside to outside. To lead quality improvement better, professionals have to connect with their team members and other individuals to consult on what are the best strategies to enhance pain management. This can assist in addressing all the needs of the patient, minimizing error chances, and preventing harm for the patient, because safety is our number one goal. Safety and comfort in these patients. This also enhances patient safety. Preventing medication errors enhances patient experience and outcomes, which in turn reduces healthcare costs. Support obtained from different team members also improves all aspects of work, leading to improved work-life quality for healthcare workers. According to Brugman et al. 2022, motivation is a crucial interprofessional perspective that encourages providers to provide the best care but also become satisfied with the work. This supports increased efforts to minimize errors while improving and enhancing work-life quality. Slide 9. Promoting interprofessional care calls for effective collaboration strategies. Planning and care coordination are some of the essential strategies needed. They ensure individuals understand their roles, when and how to execute them. At the center of collaboration is communication, which involves different tools. One of these is a well laid down structure that shows how the message should be conveyed and emphasizes clarity and relevance. A common communication channel could be daily meetings, daily rounds, which usually is in the morning after all the patients have been assessed. And it can be used to bring the interprofessional team together to share their progress, their concerns, their thoughts, and possible solutions as a team so the patient can have the best result. Another aspect that can be used is technological communication, which is provided by the hospital, maybe through an app or through a chat service, ensuring that HIPAA privacy laws are followed if meetings are not able to be held. Slide 5, conclusion. Data is a crucial tool in informing healthcare practices. It allows providers to identify successful and unsuccessful areas needing optimization and modifications to provide better patient care. The gaps identified allow for the development of quality initiatives that address healthcare issues and improve patient outcomes. The success of quality improvement strategies depends on interprofessional collaboration to promote patient-centered care. Interprofessional teams also require effective communication strategies to enhance collaboration efficiency. So I have attached my PowerPoint and the speaker notes, which I read them, and these are all my references. And I'm sorry for any nervousness, but I hope you enjoyed my presentation. Thank you so much.